Hey everyone, welcome back to all my listeners. This is episode 7 in season 16. Today is Wednesday, October 15th, 2025. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. All right, you guys, I hope you are enjoying a lovely month of October so far, enjoying the fall weather, the fall foliage. Hopefully your colors are popping more wherever you live. Now, in today's Newsworthy, I really wanted to shine my spotlight on Breast Cancer Awareness Month because it is the awareness month for all of October. And as a listener of mine, perhaps you recall, I talk about it that breast cancer is personal to me. It affects me personally. So it is a cause that is very near and dear to me all months of the year, but I definitely talk about it more and shine my spotlight more during the month of October. So I really wanted to pay particular attention to breast health in any way I can on all of my various platforms, articles I write, talks I deliver, etc. So it's really, really important to me. So I wanted to focus on it here in today's Newsworthy. And I'm going to go over and carry it on in my Trusty tip, where I'll be discussing fine needle breast biopsies. And I'll finally go ahead and close out and round out today's episode with a remarkable quote on resilience, perfect for any of us who are affected by breast cancer or any other type of cancer, right? Another remarkable quote on resilience from Elie Wiesel. All right, you guys, let's get into it. So in today's Newsworthy, October is Breast Cancer Awareness Month. October 13th, just a few days ago, is nationally recognized in the United States as Metastatic Breast Cancer Awareness Day. Did you know that about 168,000 women in the United States are estimated to have metastatic breast cancer, which means cancer that spreads beyond the breast to other parts of the body? Some researchers believe that this number will rise to over 246,000 living with the disease by the year 2030. Now, despite the growing number of people living with metastatic breast disease, most money for breast cancer research doesn't go towards studying it. Now, Metastatic Breast Cancer Awareness Day seeks to educate the public about the challenges that people with metastatic breast cancer face and the need for more research and more treatments for this deadly disease. Now, organizations like MD Anderson Cancer Center helps us get to know more about some of the symptoms and signs of breast cancer. Now, they may not always mean that you have breast cancer, but they may indicate that you have other health problems. So it's important that you recognize some of these signs and symptoms. Now, MD Anderson talks about breast cancer symptoms vary from person to person, and there is no exact definition of what a lump or a mass feels like. The best thing to do, according to MD Anderson, is to be familiar with your breasts so you know how normal feels and looks. If you notice any changes, tell your doctor. While regular self-exams are important, many breast cancers are found through regular screening mammograms before any symptoms appear. Now they go on and tell us about breast cancer symptoms that may include a lump or a mass in the breast, a lump or a mass in the armpit, breast skin changes, including skin redness and thickening of the breast skin, resulting in an orange peel texture, dimpling or puckering on the breast, discharge from the nipple, scaliness on the nipple, which sometimes extends to the areola, nipple changes, including the nipple turning inward, pulling to one side, or changing direction, an ulcer on the breast or the nipple, sometimes extending to the areola, swelling of the breast. All right, and now next week, well, starting on Friday and then throughout next week, is all about men and breast cancer awareness. Now, did you know that men can also get breast cancer? Now, according to the American Association for Cancer Research, an estimated 2,800 men are expected to be diagnosed with breast cancer in the year 2025, and about 510 are estimated to die of the disease. Radiation exposure, high levels of estrogen, and a family history of breast cancer can increase a man's risk of the disease. And now it's time for my best practice tips in Trusty Tip. So let's continue shining my spotlight on breast cancer awareness. And let's talk about breast biopsies, that first step that is taken. So it really is, in my opinion, one of the first things that you're scheduled for. If a lump is found on your breast, you will be scheduled for a breast biopsy, usually a fine needle biopsy. What is a fine needle biopsy? Now, some facts about the procedure include that it's going to be done by a fine gauge needle, usually a 22 or a 25 gauge needle. And the syringe are used to sample fluids from the lump, the lesion, or the cyst, or to remove clusters of cells from a solid mass. Now, the fine needle aspiration biopsy, the FNA biopsy site, is going to be cleaned, and the physician locates the lump by palpation, which means he's going to feel it or she will feel it, and guides the needle into the target site. Now, after the needle is placed into this mass, a vacuum is created and multiple in and out needle motions are performed. Several of the needle insertions are usually required to ensure that an adequate tissue sample is taken. Now, the samples are then prepared by smear onto a microscope slide and are allowed to air dry. Then they're fixed by spraying or immersion into a liquid substance. Now, the fixed smears are stained and examined under the microscope by a pathologist. Now, fine needle aspiration, FNA, does not require stitches and is usually performed on an outpatient basis. A small bandage is placed over the site after the procedure. Many patients resume a normal routine the same day. So there's that explanation of what the procedure is. It's pretty simple, not that painful, just the typical pinches that we feel when we get an injection. Now, let's move on. What about coding for fine needle biopsy procedures? It's important to turn to your CPT guidelines. Now, remember, you can report CPT code 10021 for the first lesion biopsied by FNA with no imaging guidance, which means the physician does not require any imaging. They can simply locate it by palpation, by touch. Now, so that's that code 10021 for the first lesion biopsied with no imaging guidance. And there's an add-on code 10004 for each additional lesion. Now, our AMA CPT guidelines have an entire section for us to review, and it is for fine needle aspiration biopsy procedures. And it states FNA biopsy procedures are performed with or without imaging guidance. There are imaging guidance codes. For example, they give you the list 76942, 77002, 77012, and 77021 may not be reported separately with CPT codes 10004, 10005, 10006, 10007, 10008, 10009, 10010, 10011, 10012, and 10021. Now, the codes for 10004 all the way through 10012 and 10021 are reported once per lesion sampled in a single session. When more than one FNA biopsy is performed on separate lesions at the same session, same day, same imaging modality, use the appropriate imaging modality add-on code for the second and subsequent lesions. So make sure that you read all of those guidelines because you can really understand what sections you should be going to when it comes to those add-on codes, especially for the imaging modality. Now, when more than one FNA biopsy is performed on separate lesions, same session, same day, using different imaging modalities, report the corresponding primary code with the modifier 59 for each additional imaging modality and corresponding add-on codes for subsequent lesions sampled. Now, this instruction applies regardless of whether the lesions are ipsilateral or contralateral to each other, and or whether they are in the same or different organs or structures. Now, CPT Assistant also gives us more instruction on reporting. So CPT code 10021, which is defined as fine needle aspiration biopsy without imaging guidance, first lesion, and CPT code add-on code 10004, which is defined as fine needle aspiration biopsy without imaging guidance, each additional lesion, list separately in addition to code for the primary procedure. Now, these are reported when imaging guidance is not used for the first lesion and each additional lesion. You've got to look at those fine details in the parenthetical notes. Now, CPT codes 10005 through 10012 describe the FNA biopsies performed with imaging guidance. So there it is. It says it right there that those codes starting with 10005 all the way through 10012 are the codes that talk about the lesion with imaging guidance, specifically ultrasound guidance, fluoroscopic guidance, CT or computed tomography guidance, as well as MR or magnetic resonance guidance. This imaging guidance is included or bundled into these codes, and so those imaging codes should not be reported separately because there's a whole separate section in our CPT books for the imaging CPT codes, right? So we don't need to use those because the imaging guidance is already included or bundled in our CPT code range 10005 through 10012. So follow those parenthetical notes under the codes because there's a wealth of coding direction in the parenthetical notes. Now remember, an FNA biopsy is performed when material is aspirated with a fine needle and the cells are examined cytologically. Now, it would be incorrect to report an FNA biopsy code for aspiration only. Pay close attention to your provider's operative report to ensure that you're abstracting the correct set of CPT codes to capture fine needle aspiration biopsy procedures. And finally, I focus Season 16 Spark on resilience. I want this 16th season Spark to be filled with our world's thought leaders, writers, artists, philosophers, everyone who inspires us with their statements involving resilience. So, in this week's inspiring quote in Spark is from Elie Wiesel. No one is as capable of gratitude as the one who has emerged from the kingdom of the night. Absolutely true, right? This quote goes so deep. It reminds us of how much gratitude and humility we are capable of when we are faced with unbearable days, months, weeks of darkness. We are grateful when we come out on the other side. I'm happy Elie Wiesel's spark burns brightly and can continue to inspire so very many. All right, you guys. Well, that wraps up today's short and sweet episode. I really wanted to get you guys a lot of information out there on Breast Cancer Awareness Month. So definitely check out my LinkedIn profile as well for additional information and all of the links to resources and organizations that publish all of this information. So I just wanted to get my voice out there in the world and make sure that you are doing everything that you can to be aware of what you can do when you find a certain sign or symptom in the breast. So anyways, you guys, wanted to make sure that was shared. Now, again, there's just another week or so left before my telehealth playbook for 2025 through 2026 workshop takes effect with my dear colleague, Keisha Wilson, as well as a fantastic, phenomenal global practitioner of telemedicine, Dr. Michelle Griffith. So we're going to be talking about all things telehealth and what is current and upcoming after the deadline that we just went through, right? Where our US Congress has not passed any of the telehealth flexibilities. So what do we do now? We're going to be talking all about that. So definitely check out that link in my show notes that I provide to you so you guys can try and attend if you can. All right, you guys, I hope you really take the time to decompress and find some peace at the end of your weeks after a very, very busy work week. Definitely take the time to reflect, have moments of silence, check out what your next steps are going to be in life, etc. Just find moments of clarity at any chance you possibly can. All right, you guys, thank you so much for listening on today's episode. And I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.